All right, everyone, we're on to our next segment. I'm really excited and glad that we can present Dr. Jamie Mansell from Temple University. She's an associate professor and director of the athletic training education program at Temple. Very important topic for us to reflect on and to be aware of. She was talking about sexual harassment, protecting yourself and protecting your patients, and really put it in the frame of the life of an athletic trainer. So Jamie, thank you so much for talking about this topic. And I want to get into some of the main points you discussed in your presentation. The first is you talked about the importance of being intentional and very self-aware of what we say, how we say it, and what we do in our environments. Can you kind of expand on that a little bit? Why is that so important?
Sure. As healthcare providers, we need to ensure a safe environment for our patients. The patients have to feel safe with us. They have to feel like we have a welcoming environment in order for them to come to us. So we're really doing them a disservice if we're not advocating for them, if we're not, being careful of the words that we choose to use. And I think we have to keep in mind that we're not in the business of just ankles and knees. We have whole patients and whole people that have a lot of things that go into that. So I think when we're looking at this from the holistic and patient-centered care practice, we really have to be intentional and look at that whole person approach. And I think that sometimes people don't realize that some of their words or some of their actions can be perceived in ways that are different than their intentions. And I think my biggest message there is if someone is interpreting your words or your actions as harassment or as misconduct, then that's kind of the line. You've crossed over it. We apologize. We make better choices as we move forward.
And that goes along really well with what Kevin Silva was talking about, emotional intelligence, about it really being linked to perception of what others think. And that I'm so glad that you mentioned that, because that's so crucial, that self-awareness, and especially when it comes to sexual misconduct, sexual harassment. And you mentioned there was a spectrum that occurs, a spectrum, a continuum of the different levels or types of sexual misconduct that occur at work. Can you kind of speak to what is that spectrum and continuum?
Sure. So the continuum is pretty vague and it leaves room for a lot of question. But essentially, you can think of it as going from generally not offensive down to egregious misconduct. So things that are generally not offensive, maybe some remarks on your hairstyle or your dress. And then as we continue, maybe awkward, mildly offensive. Now we're talking about, things that might imply that gender distinctions are unfavorable. When we move down to offensive, these are usually gender insensitive or maybe acting in a superior manner. Highly offensive are normally when we have these intentional degrading remarks. Evident sexual misconduct is when we have behaviors that are crude or physically intrusive. And then those egregious sexual misconduct actions are usually involving coercion, sexual abuse, rape, and things of that nature. And I think it's important to know where these things fall on that continuum. But I also think it's important to remember that a lot of other things play a role in that. So your previous relationship with the person that you're speaking with, your tone, the way that you carry yourself, your eye contact. So if I'm talking to one of my good friends and I say, that sweater looks great on you, that's probably going to be generally unoffensive. And they're probably going to say, oh, great, thanks. I just bought it yesterday. But if I say that to someone that I don't have that previous relationship with, and maybe I linger a little bit too long on a certain body part, or I raise my eyebrow, or I say it in a different tone, then that seemingly inoffensive comment can really carry a lot of different weight, and it can move along that continuum to somewhere else.
And you also mentioned that the environment plays a key role as well. Not only knowing your relationship personally with that person, but also the environment and the importance of having a safe, supportive environment. Can you talk about some tips that athletic trainers can keep in mind to really create that positive, diverse, inclusive, respectful work environment to really minimize the risk of this happening?
Sure. I think one of the things that we need to think about in the beginning is starting with the overall culture of the organization. And something that people might not agree with when I'm talking to some of my students and they're looking at places of work, and they interview somewhere and they say, there was just something that happened in the interview that I didn't really feel good about. I usually say, then that's not the place for you to work. If there's something in the culture, maybe you're at the interview and somebody starts to talk over you, or maybe you're not addressed by your, formal title. Those are small indications that the overall culture is probably not one where everybody's voices are heard. So if we start to appreciate and cultivate this diverse and inclusive and equitable environment. And I'm talking, even beyond gender and sexual harassment, but even for religion and race and things like that, that's key early on. And then I think we need to always cultivate that culture. So it's something that we consistently need to work on. How do we show that we have concern for others? How do we show that we have respect for the other workers that we have? We need to work on our cultural blind spots. So these are things that are explicit biases as well as our implicit biases. Explicit might be a little bit easy for us because those are things that we know that we have a bias against. The implicit are going to be a little bit harder because those are things that are operating at a subconscious level that we really need to dig to find out. And sometimes our implicit biases are antithetical to our known belief system that we tell folks. So one great way to do that is the Harvard Implicit Bias Test. I think we also need to watch our tone. We need to watch our language. And we also need to make sure that those around us are also watching. So if we have coaches or athletic directors or colleagues or peers, or even athletes and patients that are using inappropriate language or they're gender policing, we want to make sure that we're putting a stop to that. The AT facility and the healthcare facilities should be safe environments that we're welcoming everybody in. They're our patient. We need to take care of them. It's part of our code of ethics to do so.
And what I love is that on the NATA website, there's a lot of great resources for members as well, just to help, how to deal with those difficult situations, because we don't always know how to handle that when we hear it from a coach or when we hear it from someone else. Do I say something? Do I not? How do I say something? And one of those other areas that we don't always know how to handle is like if we are in the presence of someone that we know is a victim of sexual misconduct or we suspect might be. How do you interact with that situation? What are some tips for handling that the right way?
Sure. I think first I want to say we don't always know what people have in their background. So I think it's important that we always operate on a level of respect and we always, kind of think about our words and choose them. That's kind of our theme here. We choose those words wisely because we never want to put somebody in a situation where they already feel intimidated or feel like they can't speak with you. So I always kind of operate at that level of knowing of not knowing what's in someone's background. So from there, we want to make sure that we're listening. We're there to listen, to support. If people are disclosing things to us, they're doing so for a reason. They've identified us as a safe haven. They don't need us to talk over them. They don't need us to ask questions and to probe. We just need to listen. You then also need to make sure that you're following the policies at your place of employment. So Title IX coordinators, law enforcement, human resources, always know the policies before it becomes a problem. It's not your duty to decide if something is misconduct or not. That's not your job. Your job is to follow that chain of command as appropriate. You also want to link your victim or your patient with counseling or support services. And again, you need to have those resources available before something happens, because we don't work a 9-to-5 job in AT. So we've got to make sure that we've got those resources available, both nationally and locally when we need it. And then just like we do with our ankle sprains and our concussions, et cetera, we need to maintain confidentiality in these areas too. This isn't something to gossip about. This isn't something to tell our colleagues and our coaching staff, et cetera. We're that confidential healthcare provider.
Dr. Mansell, thank you so much for hitting these key points. Definitely something that we could all dig deeper into as well. Your presentation was great at the seminar this year, so thank you very, very much for bringing this topic into the limelight and having a conversation around it.
Thank you.
Have a good day.
Thank you.